AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
On the weekends.
Hi, good evening. I'm Lorena Anderson, your life and energy coach, and also your host for this evening's show, You and Your Doctor, where we teach you how to live a longer and healthier life. We are being produced by AMP2 TV and proudly presented and sponsored by All County Healthcare, where patients are the heart of their business. So we'd like to welcome you. We're here every Tuesday between the hours of 6 and 7. And just in case you miss us, we are being taped on 95.3 FM. And they also do a replay on Tuesdays at 11 o'clock a.m. and 3 o'clock p.m. So you still have a chance of catching our show. And we are live right now, believe it or not, on 95.3 FM and 1470 a.m. Now, we would love to have you call in and participate in our show this evening. We happen to have two very, very special guests. One is an acupuncturist, so if you've ever had any questions about acupuncture, now's the time to call in. And the telephone number is 888-565-1470. So give us a call if you have any questions whatsoever. Now, if you've got any questions about your home health care, please call All County Healthcare, because they have a variety of various skilled nursing individuals. Plus, they also have CNAs, certified nursing assistants, that can help you with that. You can give them a call at 888-717-7170. Ask for Maddie. She would love to answer any of the questions that you might have. She's waiting for your call. So without any further ado, I would love to introduce to you my first guest. He happens to be an acupuncturist and been in business for quite some time. And he's got some very, very interesting and unique areas here that he's going to discuss with us tonight. His name is Dr. David Suomela. So I'd like to welcome you to the show. It's great to have you.
Thank you.
So tell us a little bit. First of all, how did you get started?
I got started in natural health and acupuncture just with my own health concerns. When I was a young teenager, I had arthritis. At 13, wow. I was diagnosed with rheumatoid and osteoarthritis at the Mayo Clinic in Rochester, Minnesota. Told to take steroid drugs, have full lumbar fusion, and prepare for life in a wheelchair.
Oh, jeez, you're kidding.
At that point, I started looking at any other option to change that path in my health. So everything from nutrition to environment to exercise to, acupuncture, a lot of natural things. And it wasn't just one thing that worked. It was a combination of the right things. So I was kind of just trying to help myself. And once I found all those answers, now I work to help others.
That is incredible. So at the age of 13, you were diagnosed with that? Did they say what the cause of it was, or did they give you any inclination? I mean, that's really young.
Yeah, my mother had autoimmune. She had lupus. She had arthritis. They thought maybe it was just genetic. I found out later it was certainly a genetic factor, but it was environmental. There was a lot of things in my home that was making me sick, from the way we were heating our house to the materials it was built with. To even certain clothes and fabrics that I was wearing. There was a combination of things that I learned sensitivity, along with certain foods and things that were in my diet that were causing more inflammation and distracting my immune system in a lot of ways.
Wow. I mean, that's a very early age. And what's nice now is that you have the ability of understanding what was going on back then. A lot of times individuals don't understand. They end up getting sick, but they don't know some of the causes.
Right, and trying to find that root cause of what was causing me to be sick was difficult, but it was a process of elimination, changing environment, changing diet, taking things in, taking them out, putting them back in, and just kind of, trying to educate myself on that and just looking so-called outside the box. But I was kind of forced to do that because my diagnosis and not so much my diagnosis, but my prognosis was, this is your path. And I learned that is your path if you don't change what you're doing. if you don't change how you're eating, how you're thinking, where you're living. Could be a combination of things, could be one thing, but really trying to analyze that.
So it's very interesting because I usually ask a lot of my doctors, where did you find the passion for what you're doing? And a lot of times, they've dealt with some issues when they were younger that put them on that path. Other times, there's somebody that all of a sudden came into their life and ignited the passion because they were dealing with a certain issue. And it sounds as if, all of those things that you were dealing with also led you into your passion.
Yeah, they certainly did. I mean, I often refer to it as being blessed with illness when I was younger because it put me on my path to helping people and knowing what it's like being sick. Nobody ever wants sympathy so much, but empathy is a very different thing. An understanding of what it is to be sick, of what it is to have to make sacrifices, of what it is to have to spend money, and what it is to have to maybe even relocate yourself to a new place or a new home or different things. Really what it takes to get better.
That's so interesting that you would, bring up that subject, sympathy versus empathy. Sympathy is, I'm so sorry.
Yeah.
Leave me alone. Really,
Yeah.
I mean, they literally feel sorry for you. But empathy is when you can sit there and you can say, share with me. I want to hear. I do care.
Right.
I might not be able to do anything about it, but I do care and I want to know.
Right.
And that's empathy. That's when you're empathetic with another individual.
Right. Don't feel sorry for somebody. You see somebody in a wheelchair and you say, I feel sorry for them. They might very well be happier than you are. You really don't know. You can't make that assumption. But to say, I can only imagine the difficulties that brings to your life and your daily routine of just getting up, of going somewhere, of getting, taking a shower. I can only imagine those added difficulties to your life when life is sometimes challenging enough on its own.
It sure is.
So.
Absolutely. And, when it comes to something of that nature, what I usually do is that I'm in awe of the courage and the strength that it takes an individual to continue on and live a healthy and normal and productive life.
Certainly.
So good for you. So how long have you been in practice?
I've been in private practice for over 10 years now. I have my practice here in Deerfield Beach in the Cove Shopping Center, and it's been really good. I'm a primary care provider, which means that I will analyze somebody's blood work. I'll look at their MRIs. I'll look at their X-rays. I'll be able to communicate with other doctors that they're dealing with. And I'm trying to get people away from that term alternative and into integrative medicine.
Oh, I like that.
So the right thing at the right time. And if medicine is not one person or another, but it becomes a roundtable discussion with all the physicians and doctors and energy coaches and everybody working together and realizing what the other person is doing and complementing each other.
Yes.
I think that's really the ultimate understanding and what needs to happen.
I love that. And I love the integrative medicine versus the alternative.
Yes. To me, alternative means I go to one person, I speak with them, then I turn my back on them and I look at my alternative on the other side. And it needs to really be everyone inclusive, or integrated, where someone might need surgery. And I might take care of them pre and post-operative. They might need a medication, but they're having side effects from it, but it's a life-saving medication and we need to help them with their side effects. Or post-chemotherapy, they might need to get their kidneys and liver functioning well to get those things out of their body once they've done what they need to do.
Wow.
So it's a different way of looking at medicine and it's not they're good or I'm good and they're bad. There's a time and place for everything.
Excellent. I love that. And it's very, very interesting too. When we're talking about, Western medicine versus Eastern medicine, I mean, from what I hear through your practice is that you're bringing the two of them together.
Certainly.
And there's no them against you or you against them.
No, it's the idea that I'm going to take what we knew thousands of years ago, what worked, what's been done. I mean, if we're practicing medicine and practice makes perfect, this system of medicine is closer to perfecting what it does. Not saying that it's more perfect than another, but perfecting what it does. And if we take that and then we look at modern research and we look at diagnostic reports and we look at blood work and we can put that all together. What did they know thousands of years ago? What do we know today? what do we know works now, and we put those things together, the person's going to get better. So I always use those techniques in combination. I'm going to use what we call master points for acupuncture, what's known for thousands of years, what does modern research tell me, and what does your individual case tell me? And those are going to customize your treatment so that's most effective.
Okay, that's very interesting. And you also add another element to that, too, if I may speak about it, and that are supplements.
Yes.
Yes. Chinese medicine, correct?
Yes, I use supplementation, I use homeopathics, and I also use direct food therapy. So supplements are supplementing to the foods you eat, because foods may not be in the potency that you need. You might have a deficiency and you can't eat 10 heads of broccoli a day. So you might need,
Yeah, it's like, or eating too many carrots, you end up turning orange.
Yes, but you might need the direct food sourced from that. So you want is food sourced supplements that can allow you to absorb those at high levels. Your body will recognize them. They won't stress your digestive system or your kidneys and liver. And then sometimes giving people specific foods to add to their diet, not just looking at what we need to take away, but what do we need to add into our system. So that's very important as well. And I do a lot of those things, and I'll send people home with just a list to go to the grocery store with. So.
Well, that's fascinating. So you're way more than just an acupuncturist, correct?
Right,
I mean, I don't know whether or not they've come out with a term or a title for you.
Yeah, they have, licensing wise, it comes out as an acupuncture physician. I'm a doctor of Oriental medicine, which means that we do acupuncture, we do herbs, we do nutrition, we do food therapy, we do body work, hands-on work, trigger point therapies, manual tractioning. We'll do a lot of different techniques that work, as well as I do cold laser therapies, which is a focused both visible and non-visible infrared light, nutrition injections, so vitamin injections of everything from B12, B6, amino acids, vitamin C, D3. So you can customize that and kind of make so-called cocktails of these injectables to go directly into the body. Then it increases what you're going to absorb from the food that you eat. I also do homeopathic injections for pain, disc degeneration, arthritis, trauma, all kinds of different things. And those are non-steroidal, non-narcotic.
Wow.
And they work incredibly well. And in most cases done with a tiny diabetic needle.
Oh, my
very
goodness.
painless.
Oh, my goodness. Well, and a lot of people that I know, especially from the old school, maybe not, from the younger schooling, but they're like, you're going to stick me with needles? No way.
Right.
It's going to hurt. And it's very interesting. You share. That was always a number one fear many years ago for me, but I totally believe in acupuncturists.
Right. And we all revert to that tetanus shot we got when we were kids, where they stick you in the arm and, the nurse sticks you in the arm and your arm's sore for a week. And that's kind of what we think of when we think about shots. Acupuncture needle is completely different from a hypodermic needle. It's actually a hypodermic needle, if you looked at it microscopically, would still be sharp. A acupuncture needle, if you looked at it under a microscope, would actually be rounded. So it actually passes through tissue. It doesn't cut the tissue. Then the acupuncture needles sit in what's called a guide tube. That's basically a little straw. It sits up about 2 centimeters above that straw. So when we place that at the location and we tap it, it goes in so quick you don't really pick it up. It feels like a little flick.
It does. I always like it. It feels like a little mosquito bite.
Yeah.
If that.
Yeah. Sometimes it usually feels like a little flick on your skin. Our nerve receptors, our baroreceptor layer of our skin is about 1 centimeter. So this goes, you press down a little on the skin, you tap that point in. It's kind of the difference of a Band-Aid fast or a Band-Aid slow. Your brain just can't really pick up the signal, so you feel that little tap. And then we do adjust it. Based on where we're going in the body, the size of the body we're working on is going to determine the size of needle used, depth, all those different things. So what we're working with acupuncture is the bioelectrical current of your body. One of the number one questions is, what is qi? Well,
what's energy? Yeah. I get that all the time.
Yeah, and
what's an energy coach?
and for one, qi is a Chinese word. So it's, if I tell my patients, if you walk in and I say mi hao, which is hello in Chinese, instead of hello, we're off to a bad start on communication. So when I talk to somebody about qi, it's energy. It's when we do an EKG of the heart, an electrocardiogram, electro. Nobody disputes an EKG.
Right.
That's qi. Okay, that's what yoga would call prana.
All right.
So it's the energy of the body. And when we talk about energy in our body, suddenly people think it's a belief system. Well, solar energy, wind energy, how about atomic energy or nuclear energy? We know these things exist, and we have trillions of cells within our body, all within atoms, all with nucleuses. There's a tremendous amount of energy in the body. So it's not a belief system. Acupuncture will work.
No, it's not a belief system.
Yeah, and it'll work. It doesn't interfere with your religious beliefs. It doesn't, interfere with your spiritual beliefs. But suddenly, when you think about it in the body, people get, very kind of take a step back, and they get a little nervous about that topic. But we're working with the same energy that beats your heart, fires your nerves, flexes your muscles, and operates the synapses in your brain. So it's a very real thing.
I really want to tell the listeners here, this is not something to be in fear of. You can do it from baby all the way up. I think that I've known of some acupuncture patients that were in their 90s, 93, 94, and it still works. It's one of the things that is healthy, it's natural, and there's no side effects. I mean, it's not as if you're going to end up, with a stomach ache because medicines didn't mix together or that type of thing.
Yeah.
So, and the other thing, too, that I wanted to say is thank you so much to our sponsor, All County Healthcare, for providing this show to help educate us, because without this education, we don't really truly know what's available out there. And we end up having some of the most professional experts in their field come in to discuss this with us. So I would just like to say thank you very much for coming in and being a part of this. But I want to continue the discussion, though, as well, because you've come up with or identified another incredibly useful acupuncture resource for addiction, alcohol and addiction.
Yes, alcohol and drug addiction, and the treatment's been around for quite a while. There's a lot of different systems using it, but what I'm trying to do is really connect qualified physicians with facilities and with patients or clients that need this service. And it's not a standalone service. It's never meant to be. Again, it's integrated with everything a facility is already doing. So what we're doing is we're going into drug rehab facilities, both inpatient and outpatient facilities, and we are performing acupuncture along with other techniques to help assist with recovery. And the centers that do this, we have statistics of, we're talking about 8,000 person studies, we're talking about 10,000 person studies at hospitals and major clinics. We're finding that we are in many cases doubling the rate of success, completion of programs. We're reducing recidivism, which is relapse, by 30-40%. We're reducing their need for drug intervention by 20 to 50%. And it's really allowing people another tool to deal with what they're going through.
Yes.
The anxiety, the cravings, the emotion, and find positive outlets for stress.
Well, one of the reasons why I bring that up is that, a lot of our listeners are in the senior arena right now. So one of the areas that happens to be on the uprise is alcoholism and also drug addiction. That's why this comment and information is so relevant, because if you're dealing with a particular alcohol problem or drug problem, please give Dr. David Suomela a call, and we'll have his information here. You can call Maddie as well for his information, because we're going to make sure that people have the opportunity of getting a hold of you. Maddie's at All County Healthcare, and that telephone number is 888-717-7170. Okay, so you can call her. But if you're dealing with a situation of that nature, please give Dr. David Suomela a call. Or if you happen to be the caretaker of your mother and father, and you're noticing that they might be dealing with a bit of an addiction problem, it's so important to get help, because it never gets any better. And not only that, but it is destroying their quality of life.
Yes.
So,
yeah, and just to ask for help is tough. I mean, men, we typically be are the worst at that. I'll have somebody crawl through my door and ask them how you doing, and they go, "Oh, I'm fine."
Crawl through your door is
just,
right.
Just
yes.
to ask to help and to simply say, "I don't have to do this alone." Like people say, "Oh, I can handle it." You don't have to.
Mm-hmm.
You don't have to do it alone. You can have tools and positive outlets to deal with that and to facilitate you to get better.
Yes.
And it's sometimes that finding that right thing. Maybe it's what I do. Maybe it's what someone else's do. Someone else does. Maybe we can point you in the right direction.
Yeah.
But getting tools to deal with stress in positive ways, because having a drink is okay, but
if you're drinking all the time,
getting done with a day of work and saying, "I need a drink," because you're stressed, is very different than dealing with your stress positively.
Yeah.
Feeling calm and feeling relaxed and say, "I would like to enjoy a drink."
Yeah.
Those are two very different drinks.
Right.
And the problem with medications today is I've had patients who have been on medication post-surgery for 7 days. They stop taking their medication. They think they have the flu. They're going through a chemical withdrawal.
Oh, wow.
So they're within 4 days, some of these medications are creating a chemical addiction. Psychologically, you might not like it. You might not be just wanting to be high or those type of sensations.
Right.
But chemically,
it's creating the
cells
addiction.
of your body are addicted to it within 4 days in many cases. So we have about 19%, the statistic right now in South Florida, of people who get in a car accident will become drug addicted
Oh my
to
God.
pain meds. So that's 1 in 5. And we see how people drive down here. There's a lot of accidents. So,
We do. And especially right now, because we're in season.
Yes.
And I have got to tell you, the traffic is interesting out there.
Yeah, and to think that, you see those accidents, that person has a 20% chance of becoming addicted to a pain medication as a result of their accident.
Oh my goodness.
So it really is a national epidemic. It's not just kids. It's people of all ages,
Yes.
all genres. That it knows no age, race, income. It's across the board.
Right. So what are some of your typical patients? Or do you have any typical patients?
Well, there's over 4,000 treatable diseases or conditions with acupuncture because it helps the body increase blood flow, reduce inflammation. There's a lot of things we can treat, but I would say most people come in initially for pain. Just simply, I have pain, or they've been through the entire gamut of medical things that haven't worked. So I'm very often either someone's first choice or I'm their last hope. It's kind of where I end up on the spectrum, but people will come in and they'll come in for pain, and I'll start treating them, and they'll say, "Is there any chance that my stomach's feeling better since having these treatments?" And I'll go, "Well, you didn't tell me you had a problem with your stomach." And they go, "I didn't know you could help with that. Is it possible I'm sleeping better? Or is it possible I feel better and I have less stress?" Because of the chemical releases, we're triggering endorphin and enkephalin releases within the body. So natural feel-good hormones. We're releasing acetylcholine, which is a neurotransmitter, helping your whole central nervous system feel better. We're increasing serotonin release, helping with sleep and calm and peacefulness, and combating effects of cortisol. So there's very measurable results with acupuncture. We're now starting to understand it. The U.S. military is now using acupuncture for PTSD. They're using it for pain. The Air Force has a very large protocol they have called battlefield acupuncture. So there's a lot of different things that it's being used for, and we're mapping the brain and the body and starting to understand the how and why of it working.
That is fascinating. That is fascinating. And, I'm just going to sing your kudos here for a little bit because Dr. David is one of my good friends, and he was the acupuncturist for the Panthers for 3 years. So, the athletes, a lot of times, they are finding the integrative medicine, as you're going to call it now.
Right.
We're going to call it. And he doing an amazing job, and especially on athletes, the kind of wear and tear that they put on their bodies. I would imagine that they were in your office all the time.
Yeah, and a lot of times the interesting thing was with them, it is a roundtable discussion with the physicians. We have a team of doctors that take care of these people, and they get paid millions of dollars in most cases to do what they're doing, and missing games is expensive.
Yes.
And they also are learning that preventative medicine is saving them. So if they feel something a little off in their body and they treat it before they find they can avoid an injury, they can miss 1 game instead of missing 6 games or missing a season. And very often we're pointing them in the right direction, and we're working as a team. And it's an interesting thing because every country in the last Olympics, every major country had its own personal acupuncturist.
Wow.
You know, every sports team in the NFL, they use it. Most of the NHL uses it. These people are using it for all different conditions, from preventative to speeding and accelerating healing. You know, with soft tissue injuries, we usually increase them 30 to 60% for the recovery times.
Oh my goodness.
So we get them back on the field or back on the ice faster and a lot healthier.
So please let our audience know how they get in touch with you.
Yes, you can call my office by calling 954-234-6005 or 954-427-3112. Oh, I'm sorry, 954-420-3112. You can also look us up on the web at pureacupuncture.com. That's P-U-R-E acupuncture.com.
Excellent. And he's located in Hillsborough, in the Cove, correct?
We're in the Cove Shopping Center,
Okay.
basically right by the Intercoastal Waterway there, and beautiful facility and a number of different people that assist me in helping people as well.
Excellent. So thank you so very much for coming, being part of the show tonight, for helping to educate us and inform us, and, giving us a real, true alternative integrative medicine an alternative to integrative medicine and what's available. But we're going to go on a commercial break. Please, whatever you do not leave. We're going to be right back, and we have Dr. Lori Ben-Ezra coming in. She's a psychologist. So please stick with us, and we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach, and you're here at the show, You and Your Doctor, teaching you how to live a longer and healthier life. And it is being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. And I'd like to say that we're here every Tuesday from the hours of 6 to 7. We're streaming on 1470 AM and also 95.3 FM. And in case you have not been able to hear the show today, next week on Tuesday, they're going to play it again at 11 o'clock a.m. and at 3 o'clock p.m. Also, I'd like to do a little shout out to all of our Facebook fans on All County Healthcare. It's great to have you there because we are streaming live. And we're also on wwnn.radio.com as well. So, welcome everyone. We happen to have our next doctor here. and I'd like to welcome you. You were one of our guests prior, and there are so many things that we can delve into, talking about cognitive, behavioral events, and also psychological events that happen in an elderly or senior population, especially when, we're starting to step into this almost gray area when we're going through our retirement or whatever. And luckily some of them get to retire early, but there's always the wear and tear that's happening not only on the body but also on the mind and the emotions. So that's one of the things I'd like to talk with you about, what they might be able to expect at some point, what they're dealing with, how to look for help, and not only that, but welcoming the new year. Because that happens to be a really big piece here. We just came into a new year, so it's welcoming that new year. So welcome.
Thanks, Lorena. Thanks for having me back.
Absolutely.
I'm Dr. Lori Ben-Ezra,
Yes.
and I'm a local psychologist. And before we went on the air, we were actually sharing about what New Year's means to each of us. And I like to make a theme of a word for each year. And my theme for the year is connectivity.
That's a great word. I love that.
I think it's something that we all can benefit from.
Oh, absolutely.
Often we feel isolated. We feel that our problems are unique to ourselves, and we just sort of sit and stew with them.
Yeah. Or, a lot of times we are in social situations and everybody else seems all fine and happy and no problems whatsoever, other than, they got to go to this doctor and that doctor and that doctor. But emotionally, it's like, everything's fine. So they might feel very uncomfortable and saying, I've got some issues going on.
It's not only socially, but to me, it's compounded in the social media world that we live in. Nobody posts on Facebook or Instagram that they're feeling sad, that they had a problem, that they're struggling with depression, that they just had a setback, that they lost a job. They're posting, their vacations, their new grandchildren, all the parties that they're going to. And that can make the rest of us feel a bit like our lives are just not measuring up.
Oh, yeah, you're right. Absolutely.
And it is important that we realize everybody is coping with something.
Yeah, we're not in this boat alone, my dear.
No. By far. And it means opening yourself up and being vulnerable to share what's going on with you. And I can almost guarantee that the person you're sharing with will feel relief that they can open up back to you and say, yeah, you're right.
Yeah, I'm
also
dealing with this too.
Yes.
I'm so glad you said something. And how are you dealing with it? And this is what I'm doing. And
that brings us back to that word, connectivity. When you can connect and share a common bond and go through something together, it makes it a lot easier.
Oh, yeah.
And connecting, that could be with friends, it could be with all sorts of professionals, it can be with relatives, and it just takes opening yourself up that little bit.
Yes. And knowing that, the more that you close your mouth and the more you isolate, and unfortunately, the more that you isolate, the more you isolate. So, you're absolutely right. It is absolutely essential to do that, connecting. And remember that everything is a relationship. So, whether it's a relationship that you have with your animals, if you have animals, or with your loved ones, with your car, your money. Hello.
Right. And I'm going to suggest that we really work on, I'm a big animal fan, but it's the human relationships that really make the difference.
Yes.
And if there's a takeaway for listeners out there, if everybody could make one new connection or strengthen one connection this week, I guarantee that it'll come back and make you feel good 10 times over.
Yes. And something, when you do connect with another human being, and of which is very important, what you have done is created a level of intimacy with that other individual. And it's so nice, it's so relaxing to know that there's somebody else there who cares, because you'll be able to tell whether or not someone really is wanting to make that connection with you based on how they interact with you.
And not everybody has to be your best friend or your most intimate confidant.
No.
It's
about creating friends.
Right. And you don't know what it is that could start that moving.
Yeah.
So being open to it at all times, a smile to the grocery checkout clerk. Yes. You don't know where that leads. It's sharing an issue with your neighbor. It just opens it up from somebody where you just are saying hi in the hallway and becomes a lot more.
Yes. And not only that, but even in our population, in our senior population, it's so absolutely important, especially if someone has lost their loved one, because it can be devastating. Because, a lot of times if there are siblings or children or whatever, grandkids, they're off in another state most of the time, or they're busy dealing with their own life, and they don't always have that opportunity of being able to reach out and talk, every day or every other day, and it can get really quite lonely.
It's a very difficult transition, Lorena, to go from having a partner who you're there for each other to not.
Yes.
And it does take work to rebuild all the connection that you felt with that person.
Yes.
You might need to replace with 3 people, with 4 friends. And going out and working on that is important. And if you're feeling like you're struggling with that, talk to others in the community. Talk to your doctor.
Call Lori.
Call
me.
Dr.
Lori. Yes. Absolutely.
Right. If you are struggling with a way of how to make friends, how to recreate a social group, if you have recently moved here or suffered any sort of change, opening yourself up and asking for help from a professional is something that might initially be a little bit frightening. I know that after you will walk out of the session, whether it's with me or somebody else, feeling like you've got a load taken off of your shoulders.
Absolutely. And not only you find somebody that is very empathetic and very compassionate and passionate about their work as well, but also a great resource for you as well, because they're very connected to the community, so they know what's available out there, whether it is a senior center that you can go to where there's other seniors there, or whether it is maybe you love to read, maybe it's a book club, maybe there's you need to get out and exercise, so there's an aqua exercise group that you can go to, in the swimming pool and everything. But it's a great source.
And I'll tell you what else, I'm a big fan of volunteering and giving back. Sometimes the best way to cope with your own feelings of sadness is to go give back in any way that you can to the community and realize that somebody's counting on you.
Yes. And you still have something to offer.
Absolutely.
Age has nothing to do with it. I was taking a look in one of my articles, and there was a video that came through, and here's this gentleman. He's in this 95. He's in the hospital, in a nursing home, and he is still weaving baskets.
I think
Did you
I
see
did.
it? Oh my God, yeah. And I was like, and he says, I don't care. I'm
Yes.
still functional, and I'm still going to provide whatever I can, and I'm not going to let my age or my disability stop me in any manner.
Oh, everybody
Loved
has
it.
something that they can offer to somebody else.
Absolutely.
And the older you are, the more experience and wisdom you have to share.
Yes.
Whether that is reading with young children, sharing a history lesson that to you, you can bring alive.
Yeah.
There's
Or just your stories.
for sure.
Oh my goodness. And and one of the things that I do, because I do work with some of seniors, one of the things that I always say is get out your iPad, okay, and turn it on to the camera, the video camera, and record your stories. Because I know that as I was growing up, I don't remember all the stories. And my mother, she keeps telling me, she says, don't you remember when? And I'm going, I don't know. I don't remember. So, and unfortunately, I think most of the kids these days don't quite have a memory, or they don't remember. They've not been open to all the wisdom and knowledge that our seniors have.
And we're fortunate that technology offers us easy access to record.
Yes, even if it's your phone, you know?
Right. and how interesting it is to get a perspective from our seniors about what that phone is now and how communication was 60 years ago, 70
years ago. Yes. Oh my goodness. Or you still needed a cord, on your handset to be able to talk, and you did not get any kind of telephone connection whatsoever if you were in the car or if you ended up going out for dinner.
No.
Yeah. I mean, where would we be today if we didn't have that phone connection everywhere we went?
And that's another lesson that seniors have to give the rest of us is that, you know what? Life went on without being on technology as much as we are. Mm-hmm. And even in terms of parenting, some of us are just overbearing on how much we need to know about where our children are. And what kind of lessons our grandparents and our seniors can give in terms of laying back and not
relaxing
needing to
a little
bit as much as we think we do.
That's very interesting. Yes.
There's a lot of wisdom. So if you're out there alone and have the opportunity, please think about how you can give back. There's all kinds of places to volunteer and share. And that is a very nice way to connect. And again, I'm gonna use that word connect a lot tonight, Lorena.
I like it
because it's just connecting is a way to just avoid feeling alone and isolated.
Yes,
and building relationships is what life is all about.
Absolutely, and so is smiles. Anytime you can give a smile, give it. It's free of charge. It doesn't cost anything, and what I find is that when you put a smile on your face, it does something to your own energy, your own attitude. And people love to see somebody smile. I mean, there's a few out there that'll give you a dirty look, but who cares? Keep smiling anyhow. It feels good. It makes you feel good.
It's hard to feel stressed if you're just smiling.
Yeah, absolutely.
You can cope with a whole lot.
Absolutely.
If you just maintain a nice positive attitude and live in the moment and...
Yes, and smile.
Yes.
At strangers,
At everybody.
Yes, absolutely.
Stop at a red light, turn over, smile. Smile at the cash register. Smile wherever you go.
And that brings up a great segue. So, All County Healthcare, I've got to tell you, I love this company. They're our sponsors, and they do such a great job on taking care of their patients. I mean, they say patients is the heart of their business, but their ability of really connecting with their patients, with the smile, with the compassion, with the care is extraordinary. And so I just want to thank All County Healthcare for sponsoring this show and bringing professionals like Dr. Lori here with us today, and Dr. David Suomela, who came in earlier, the acupuncturist. Thank you, All County Healthcare, for providing this for us, for educating, being able to educate you and give you insights about whatever issues you might be dealing with, whether they're physical, mental, emotional. We're here to help you.
And they're a resource. It's important to reach out to the community resources to help get a sense of what might be going on, whether that's for yourself or for your loved one.
Absolutely. So if you have any questions, even for Dr. Lori, please give us your telephone number. How do they get a hold of you?
So my office number is 954-641-8700. If there's any questions that you have about how you might be feeling, how you might want to connect to different community resources, please feel free, pick up the phone. I'd be happy to talk to you for a few minutes, give you direction, and answer any questions that you might have.
Excellent. That is wonderful. And if you have any questions for All County Healthcare, please call Maddie She's at 888-717-7170. She would love to answer any of your questions as well. And in case you didn't get Dr. Lori's... Dr. Lori?
Sure.
Yeah. Okay. Her telephone number, call Maddie as well, because she will have it on file and she'll be able to forward any phone calls to you. So let's talk a little bit also about some of the other psychological issues. I mean, we're just coming off of a very large holiday. You know, we had Hanukkah, Christmas, New Year's Eve, and a lot of times, you know, all the families end up coming down and sharing time or making sure that the grandparents are involved in whatever is happening. What are some of the things that they can then do after everybody's gone? Because that can be pretty depressing and lonely.
Right. So again, maintaining those relationships in whatever way it works, whether that's calls, email, texting, and it doesn't have to be long. You know, now we're in an age where you can just text a hi, I've been thinking about you. And once a week, if you have a list of people that you can reach out to once a week, that's a nice way to remain connected.
I like that.
You know, and if you're doing that even once a day, you set aside time. How often do we find that you get up, the day goes by, it's 9 o'clock, you're ready to shut down, and I really wanted to call my aunt, I would have liked to have reached out to my brother, and the time just goes. Set aside a time, something that works for your schedule. Some people are early morning. Have your coffee, reach out.
Yeah. Oh, and just call. You know, I understand about texting and everything, but our voices are so precious, first of all. And they have a tone to them and a vibrational quality. And other people can feel that. So pick up the phone and call because they want to hear your voice. They don't want to see words on the, you know, the phone or on the email. Give them a call. Let them hear your voice because, you know, as we all know, there will be a time where that voice will no longer be present here on this earth. And it's so absolutely essential to allow not only yourself to be able to hear other people's voices, but also for your loved ones to hear your voices as well.
And talking provides another opening into the emotions that you just don't get through written word of any way.
You're right.
And you can just get whether somebody's feeling sad or happy and excited or down.
Yes.
And reaching out, again, doesn't have to be a long phone call. You know, whether your time is pressed or the person you're calling has a busy lifestyle, set the pattern for short, quick, touching base sort of moments.
So exactly. So, you know, when you're calling your children, keep it short because if not, they might not answer the next time.
Short and
sweet,
yes,
and loving. Yes. Hi, honey. I love you. I miss you. I just wanted to reach out, say, you know, hope you're doing all right.
Right, and it's a time to share.
Exactly. Or, you know, even if you have to make it short and sweet at that very moment, see if there's another time during the day or in the evening that you can connect and really share.
And don't feel bad if somebody puts you off.
Oh, yeah.
You know.
It's not personal. Do not take it personally, right?
Correct. Appreciate that somebody felt open and honest enough with you to be able to say, Mom, it's not the right time.
Yes, I know. We both have them, don't we?
Yes, but hear that out. Don't take offense.
No.
Let's be respectful.
Exactly. Because I have a couple daughters as well, so you know I understand that very well.
Right, and take the lead from the person that you're calling. You know, in terms of their time and how much they want to talk and how often they want to talk.
Yeah, that's a good idea.
And don't have it be all one-sided.
Yeah,
if somebody's called you 3 times, and again, it doesn't have to be something you're counting and keeping track of and tallies and all that. Have a sense. It's nice for them to see your name come up on the phone.
Yes, very well said. Absolutely. Absolutely. So, what other tidbit can we leave our audience with this evening that they can implement?
So again, I am going to stress the need to take a leap and reach out to somebody that they're not so close with and get to know them and make an opportunity this week to get to know somebody new. Share your stories, listen to theirs. You'll learn something. You will connect with somebody, and it's a really nice way to start 2017.
Absolutely. You know, as you were talking, it reminded me that in the mornings, you see in some of the diners at the counters, you know, these gentlemen that have all come together, they're having breakfast together, and that's where they met. And every morning they do exactly the same thing.
Right. I also have, it's another one of my observations. I work out at the JCC, and it's been my experience that no matter what community center I've ever been to, there's a group of men who play handball every morning.
Really?
Correct.
Oh, my goodness.
And find something where you can become part of that regular group that are at the local diner, that they're at the local
Dunkin'
community
Donuts.
center,
Yes.
whatever it is. It's just nice to be part of that group where they are remembering, you know, that you are supposed to be there. So
I love that, yes.
Find something, whether that's a volunteer organization, a diner, a social club, an
Yes.
athletic event.
A gym.
A gym.
that has a pool, because I've noticed that a lot of them go for awkward exercises.
Correct. And there's gyms around the country that are part of a Silver Sneakers program.
Oh, yeah, that's
and
right.
It's a free membership.
Oh.
And a way to connect and stay physically and mentally healthy.
I love it. Because when you do that, you add to the quality of your life. And when you add to the quality of your life, you add to the quantity of your life as well. So I'd like to thank you again so much for being on our show this evening. It is always a pleasure to have you here.
My pleasure, Lorena.
And let the audience know one more time where they can reach you.
Again, please give me a call if you're struggling with anything. 954-641-8700. I'm Dr. Lori Ben-Ezra.
Thank you so much. And thank you for joining us this evening on You and Your Doctor. We are here every Tuesday evening between the hours of 6 and 7. And if you happen to be a doctor and listening to this, please, by all means, give us a call, because we like to interview you and see if you would be willing to come on the show as well and help educate us. You can call All County Healthcare at 888-717-7170. Thank you again, and we'll see you next Tuesday.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.